Let me know if I get too low. So, as I mentioned before, I'm putting in our volunteer program. Living Legacy developed a volunteer program back in 1998, and we all in the public ed department used to have our hand in the volunteers. But
One quick second. Mike, you.
oh,
Okay.
oh, so I'm having
Now you can relax and finish Shirley.
okay. And back in 2004, Charlie Alexander, which some of you met yesterday, decided that he wanted one person focusing on the volunteers. And then I rolled into that position. And so since 2004, I've been doing various things with the volunteers, trying to increase our volunteer program. And it's been a challenge, but it's been really great. So the ABCs of volunteer recruitment. Advertise. A lot of you probably have community newspapers in your neighborhood that you can just place an ad in for free. So that's a good place to try to recruit people. The brochures, I did bring a sample of some of our brochures if you want it. We have a brochure about our volunteer program, and it has a description of all the various types of things that we have for our volunteers to do. So please feel free to pick. Actually, I'll just go ahead and pass those around as well. And C is college. I don't know if you ever thought about going out to the college campuses and talking to the certain organizations on the college campus to see if they'd be willing to take on your cause as a way to promote organ and tissue donation. Can you just kind of explain to me, like right now, like anybody can just jump in, and how do you recruit your volunteers, or where do you usually pull your volunteers from? Anybody want to share that?
Well, my work, the chapter I'm with, people come to it who have had transplants typically, or who are waiting for transplants. And basically, we pull volunteers from them.
Okay.
How do they find you in the first place?
Well, that's a good question. I'm trying to, either ongoing members, occasionally coordinators at the local hospitals. Internet, some people are saying they came because they saw something on a website. I guess those are the three I'd
Okay.
point to.
Anybody else?
Steve, let me just add, and if you're going into this, you just shut down.
Okay.
Once you get them visiting you that first time, what do you do to really recruit them to be part of the group ongoing?
We
Why they come back?
have any,
Okay.
I mean.
So just
we
a
have
natural
someone
attraction, what's
calls
going on?
them- We have someone who calls them and says,
Oh.
we're glad you came, we'd
Oh.
love to see you again.
Okay.
Okay, but in terms of corralling them into volunteering, no.
I'm sorry, I meant in the sense of just bringing them back, so that's a very unique answer, and you didn't probably think that it's being important, but it's very important.
Now, for most of you, when you do have a group of volunteers, are they doing like information tables and groups to promote organ and tissue donation? Is that what most of you recruit your volunteers for?
Usually when we're doing that, we're doing it for the OPO.
Okay.
So we're not putting out Trio stuff there.
Okay.
Now, the reason Dash, for example, Susan,
Yeah, we did it. We have our OPO has a large fundraiser. It's a run walk event. This past year they had over 7,000 people there, and we had a trio of people there.
Okay.
Trio.
So you're looking to recruit trio members more so than volunteers. Okay. Okay. So now I get it. Display table. So like you mentioned, the walk run is one example. When you're doing events for your various OPOs, when I do events, I always have like a stand that I have like a wanted sign, people to join either. Like previously, I went to a couple of events where we had donor families, and I advertised I looked for donor families. It was for the games, but whenever I do a display table or any type of event, I always, advertise that I'm looking for volunteers, or I'm looking for, donor families, or I'm looking for team members or whatever. So I would say, like, whenever you're at events like the Dash, make sure you have a little something you can sit on the table just to publicize Trio, and that you're looking for new members as well. Event columns, along with advertising, they have the list of events, usually like the daily events that they list. So you can list in both places, but list your events, like your meetings, as an event. That, because some people might not look in the section where you're looking for, where you may advertise that you're looking for volunteers or new members. They may look in the event section. I know with my community paper, the first thing I do is look at the event section just to see what's going on in the area. Facebook, I think I looked at your brochure and saw that they're gonna have social networking like later on. And Facebook is a really good way to reach out to people. Fortunately, I'm not the one in my office who have to do all the Facebook stuff, but I do go on there every once in a while and see who's out there, just to see, who I can say, hey, this organization, this is what we do, to try to get some new volunteers in, or try to get some new recipients in for the team. G is general interest workshops. If you have workshops, publicize it in the community paper just to get people to come out. And your transplant centers is a good way. And most of you, I'm sure, are connected to the OPL and the OPL. And for us, like Team Maryland is separate from my volunteer program. So if I'm having a volunteer event and I have some Team Maryland members who aren't volunteers, I still invite them to come along, because I want them to be a volunteer, vice versa, as well as if I have a donor family or recipient or somebody in the volunteer program, I want them to be a part of Team Maryland. So I do interchange the groups to try to get them to be on both sides of the fence. H, happy volunteers. So here is a little different. I kind of took this as like a volunteer recruitment, so that's why I have happy volunteers. So I guess happy team members. So it's a little different than when you have team members and volunteers. But I guess if you get somebody on your team, you want to keep them there. So you do want to keep them happy, and then you're already caring members or your liaisons for going out and telling those stories and getting
With
more.
the news yesterday, you don't have happy team.
I'm not happy about it.
By the way, just to make sure everybody knows, NCAP announced yesterday that the 2012 games have been canceled. And it's unclear from their announcement what it looks like going forward even from that. So that's been several references already, just to make sure everybody knows what we're talking about. Go ahead.
Yes. Join up. Now again, because I thought it was like more reaching out for volunteers, so we can ask Jay, but it was reach out to your local groups. Maybe to your transplant centers, if they have support group meetings, maybe see if you can get on their agenda there to speak about TRIO and tell them who you are. A lot of times I go to, for us, our OPL, our transplant centers are Johns Hopkins and University of Maryland. So a lot of times I go to various events that Hopkins and University of Maryland have, just to talk about living legacy, who we are and what we do, just to recruit people. And I mentioned that next week Hopkins have a transplant conference, so I always go there and I set up a table and I have information about both programs to recruit pre and post patients for our programs. And these are ways that, places that you can look at, Transplant Cafe. And again, because I thought this is more towards like getting volunteers in, so I put like a couple of volunteer groups that you can ask that. But Facebook and Twitter is really great. And then I went to a conference on Thursday, and then I found out about a couple of other sites. Vimeo is Vimeo. It's like another site that's sort of like YouTube. And then doing blogs is a good way to recruit more people. We have a donor family member who writes on his anniversary of his son's death. He writes like a beautiful letter, talking about his son. And the letter that he wrote in October, Jake's death was in October 7 years ago, and the letter he wrote last year was just such a moving letter. I was sick and at the doctor's office reading the letter, and I was crying, and they thought that I was in pain. No, I'm reading an email. And it was just such a moving letter that we asked him if we can post it onto our blog. And he said yes, and we did. And a lot of people, read it and liked it and, told their stories. And that's a way for me to kind of say, okay, you're a recipient, this is what we have going on. They'll try to get in that way. So we got them, now what? And again,
Just to clarify for you.
Yes.
You were fighting with the members and first volunteers.
Yes.
We're just talking about anybody who's not gonna be a member.
Yes.
Getting them engaged makes them true volunteers.
Yes.
That's how we're using it.
Okay.
just so you know, the
Okay.
way I'm talking to them.
Okay. Okay. Engagement, training, I know when you mentioned, I'm sorry, I can't remember your name, but when you mentioned that, people just come and find you, I find that with our organization, we don't have a hard time recruiting because like he mentioned, that people come to you, they find you in various ways, but so they find you, so what do? I always like to try to make a personal call. If they contact me through email, if they call me and leave me a message, I always try to call them personally and talk to them just to see what they're like, what's their connection to donation, because most of our, on our volunteer side, most of our people have a connection to donation. So I always like to follow up with a phone call that in person, or not in person, but kind of personal touch to it. But training is really important. And for TRIO, you want to tell them who TRIO is, what TRIO do, just so they can have that clearer understanding. And if they're not already involved with like your local OPO, training them on the process, because you'll be amazed at how many people don't know where their organ came from. I've met people who had their transplant for 10 years and didn't know about the OPO or anything about it. So giving them that basic information about your organization and the whole process of everything. I'm flipping through because I wrote notes last night, so I just want to make sure I don't miss any notes. Like I said, communication. Communication is a big key. If somebody was to email you about being a member and your meeting is a month away, you don't want to just keep that person waiting there to hear back from you. You want to, make that contact as soon as possible and say, well, this is what our meeting schedule is. This is when we meet, and find out more about them, engaging them, to find out a little bit more information about them. And during that conversation, you should maybe talk about what to expect. Is there a feeder during TRIO? What TRIO? Tell them about what you do and everything. Just communicate all that in the beginning, because then they may decide, well, this is something I don't want to do, because when they assume automatically that they're going to be a member. Because sometimes people, once you tell them that all is involved, and they want to back out, and they don't really want to participate. Interests. Find out what their interests are. See, what they're looking for when they make the phone call to you. Find out what their talents are. It may be somebody that you're looking for. Not every person wants to come into the organization and be on the board or be the secretary or be the president or anything like that. So find out what their interests are, what they want to do. Do they want to come and just be a member? Do they want to come and be a member but have a leadership role in membership as well? When I talked to the volunteers, I met this lady, and it was funny because I do a public speaking workshop, and I had like all these Toastmasters notes up from the community paper that I cut out because I was gonna stalk Toastmasters to get a speaker to come and talk to the volunteers, because they see me all the time. But it's nice to have a new person, a new face to talk to. So my plan was to go to these various meetings to, find somebody in the group that would come and talk to our volunteers about public speaking and give them pointers. And lo and behold, this young lady calls me. She's interested in volunteering. Her mom was a kidney recipient, but she had her kidney, I think, 6 years before she died, and she wanted to help out. So we got to talking on the phone, and she's a huge member of Toastmasters, and then for over 20 years, I'm like, great, I got the job for you, And she said, well, I think it was a blessing that I called you, because I want to volunteer, but I didn't know what I wanted to do. So she came in February, conducted the class, and the volunteers really loved her. So I'm like, that's your job, because a lot of times we ask our volunteers to do at least one event a year. So, I schedule the public speaking for twice a year, so that could just be her event. If she don't want to do anything else, I'm happy with that, because she was great, and they loved her. The staff loved her. We think about having her come in and talk to the staff and, give us some pointers on speaking as well. Recognition is important. Maybe, I'm not sure like how you would, can somebody tell me how you would recognize somebody like that was a TRIO member?
We have a member of the year
Okay.
every year, and we recognize kind of at our holiday party, which we do all this stuff. And And then people who've done various activities during the year, we give them small awards,
Okay.
that kind of stuff. And then the member of the year gets a rather large award.
How, is the member of the year picked by how many hours they spend doing events, or it's just you come together and?
We come together.
Okay.
So,
All right. So that's a good way, recognizing your members, recognizing your volunteers. If you were to ask anybody, how do you like to be recognized? Most people want to say gift card, or right now it might be gas card. We're actually doing a survey to some local teachers in order to get them to fill out the survey and send it back. We're offering a gas card to everybody who send back the survey because we really want their input, and we like gas card. People want to send that back. At luncheons, dinners, various type of events, just to recognize people. Some people, on the volunteer side, a lot of times we ask them always to do stuff. So it's nice to just be able to come together and fellowship and not be working or not be doing anything, but just to be able to chit chat with each other and receive a free gift or a free dinner or free lunch.
Yeah, I know since I have children, they have a lot of volunteers, and every year they have like a volunteer recognition day where they have lots of events and hand out things. And it's invited to everyone at the hospital, and it's really honoring and volunteers. It's pretty cool.
Yeah, April is National Volunteer Appreciation Week, and because April is so busy for us, so crazy because it's Donate Life Month as well, we kind of got away with doing our recognition in April. But what I do is send out just a little, last year I sent out a little postcard and I taped some tea to it, like a tea bag, and I said volunteers are terrific, and mailed it to all our volunteers. So, just little cheap ways of, saying we appreciate you, thank you, but a picnic is coming up. But we just can't do it in April because we're just so crazy out of our minds. But just little gifts. One time I got those little Donate Life mints and sent them the mints and say volunteers are a worker mint or volunteers are a mint, something like that. So various little things like that. So it's a million. You can search the website, like the what's the candy bar? 100,000 grand candy bars, like that. Volunteers are worth 100,000 grand. So yeah, that candy bar. Little things like that. So you can really find some little great things to say. A quick thank you, and we appreciate you that way. Empowering volunteers. I kind of think like this empowering and engagement kind of go hand in hand together because you're trying to keep them motivated. We got them in, they're working. How do we motivate them to stay? And I just think those little thank yous and showing that you appreciate them and giving them, when you go back, when you talk to them, you'll know what they're interested in. Finding out if they want that leadership role. If they say that, oh yeah, I'm interested down the line in being a leader, maybe put them on some kind of committee, and then maybe have them lead the committee. We have some of our volunteers participate on the planning committee for the walk ride, things like, and they really enjoy that. We have a volunteer who she had signed up to volunteer, and every year I send out a letter, saying, would you like to be removed from the list because you didn't do anything this year? And every year she would say, oh no, keep me on the list, I'll do something. So just towards the end of last year, I think she was on the list for 3 years. Towards the end of last year, she said, oh, I want to come in the office and help. I'm not doing anything during the day once a week. Well, we have piles and piles of tissue charts that needed to be scanned into the computer system. I mean, we had piles of them. She came in once or twice a week, and by the beginning of this year, she had everything wiped out to the point we didn't need her to come in once a week, and that was great. That's her niche, and we kind of let her have it. So she has ownership of that project. And I sent her email yesterday and said the charts are starting to pile up again. So she said, okay, I'll be back. So I don't let anybody else do that but her. I finally found what her niche was. So, finding out, what they like and, give them various roles to see what they like to do. How do we keep them? Volunteer retention. I think that's the hardest part. Like I said, for us, I think for dealing with organ and tissue donation, people are excited. They want to tell their story. Even on the donor family side, they want to tell their story as well. They want to talk about their loved ones, so we don't have a problem with that. But I feel definitely for me, it's always a problem in keeping them. And I think finding out what their niche is will surely help keep them, giving them something to do. Key ways to volunteer retention, address their motivational needs, treat volunteers as equals. I will not ask a volunteer to do something in our office that I wouldn't do. So and sometimes we have staff because they can request a volunteer from me and, say, oh, I have this project to do. And it could be something that it could take somebody in the office just a few seconds to do. Well, I don't want to call a volunteer all the way in here to do that project. So maybe you can find somebody else. We have interns in the office. Maybe you can ask one of them to do it. So we want to treat them as equals. Particularly right now, I already have volunteers telling me I don't want to really go too far because of gas. So they don't want to travel. Like I mentioned before, promote opportunities for interaction, give them something to do so that they're interactive. You're not just always asking them to go to a health fair and sit at a table or to always speak, because then that sometimes can burn people out as well. Respect and utilize diversity. I have a volunteer who she didn't do many events, and I asked her to go to University of Maryland with me to med student health fair. And she went, she really loved it because she speaks Chinese. And she said she really gets to speak Chinese. And there was a lot of students there that spoke Chinese. And she was like, I'm so happy, I got to speak. And I'm like, okay, we do this once a year. So you can come back, once a year and do that. And like I mentioned, ownership, giving them something that they could claim theirs, to be theirs. And celebrate and recognize. And don't waste their time. A lot of times, like I said, staff will say, oh, I need this, I need that. And then the volunteer gets there and none of the stuff is ready. So then they're sitting around. I hate that. And I get so angry, so I try to get the staff to, the day before the volunteers coming in, give me what they need to do. So, because I want to make sure that stuff is there and waiting for them. It's so embarrassing to have to run around and look for stuff for them to do, or they not really have anything to do after they came in. And I'm always a big proponent on thanking the volunteers after, thank them for everything they do. Just thank them. You can change it. And again, thank you from the bottom of my pancreas. We have, I'll pass these line. We have a program called Donate Life. Yep. Oh, we have a program called Donate Life Bucks. We've always had it. The volunteers weren't using it as much, but it's like on the back page. But last year, I revamped it, and I actually gave them some items to work towards. Before, we just had dollar amounts. You can get this or you can get that. So I went to the website we ordered from, picked out a couple of things, and gave them a points value. So I have several volunteers now saying, okay, I need this amount of points to get that towel, so I'm going to do this amount of events. So they really, and I actually have the bucks cut out like a dollar bill. So when they come to workshops, I give them $5. When they do events, I give them, some bucks. Yeah. So now this year they're like, okay, I want to work towards this or that, and it's just gifts that are, inexpensive, and it will have the logo. Our volunteer program does have its own logo, which is the logo that's on the front of the book, and they're called Donate Life Ambassadors. And the logo is made up, of course, of the national logo, the Donate Life logo, and along with Living Legacy's logo of the infinity sign, which means recipient and donor family. So they really love the Donate Life bucks. And if any of you want any of that, you can just send me an email, and I can send you like the little thing here. I have the Donate Life bucks, and you just print them out and just cut them.
Is this a new program, or is it just an annual?
This has been.
I noticed your timeline down the bottom.
Yeah, we asked them by December to cash in any bucks that they're going to cash in, and some of them I let carry because nobody really utilized the program last year, and they didn't keep track, because I keep track because I do a dashboard, so I know how many hours they did, but I want them to take ownership of that themselves. So I don't just say, oh, you got this amount of bucks, so you're eligible for the hat. They have to tell me, and then I'll get them saying, well, I get them sending me email saying, well, can how many points do I have? I'm like, look it up, you have to keep track. So I'm constantly reminding them to keep track of it themselves, because I have 200 volunteers. I can't keep track of everybody. Although I do a reporting system every month, I can go back, but I'll have to trace the whole year. So I kind of make them take ownership of it. And you can't get your Donate Life bucks unless you keep track of it yourself. You submit it to me, and then I look to verify that you have those points. And then you can get the item. I do already have some items on hand, so if somebody called me and say, hey, I want the lunch cooler, then I can say, okay, I already got that, and then, you know, I can mail it to you, or you can come in and get it, or something like that.
It sort of expired at the end of the year,
Yes.
but if somebody was getting active in December.
If somebody, I would let them,
Yeah,
yes.
right.
Very flexible, not real formalized, you know. Like I said, I did let them carry them over this year, only because not that many people was keeping track last year, but beginning of the year, I said, you know, keep track of your Donate Life bucks. So, like Faith has the leadership conference in January. I do something similar. I moved from January because last January we got canceled 3 times because of all the snowstorms. So I said, well, we're going to start doing March. So we do our kickoff in March, just to kind of refresh the volunteers and do a like a Jeopardy game, just as a reminder.
So 2010 was your first year with this?
No, we've always had the Donate Life
No,
bucks.
reward program.
The Donate Life bucks.
No.
No.
Yeah.
No, we've always
Okay.
had it, but they wasn't utilizing it. So it
Okay.
kind of revamped
Gotcha.
and added an item to that. I like had something written down. You can get a T-shirt for this, for that. So I kind of picked out more items that they can get and gave them a visual of what those items were instead of having it in writing. Because they would look through the book and they were like, oh yeah, okay. But when I had this visual of pictures, then they said, oh yeah, I want this, I want that. So for some reason, they didn't pay attention because it was written out that you could get a T-shirt or you could get a hat. But as soon as I did this, they were really excited about, oh yeah, I want this, I want that. So, retention is dependent on the volunteer having all needed resources to complete their task. That goes back to not having them come in and not being prepared for them, as well as I have a little story about we had our community education manager. He said, okay, can you go to this event on Monday, get a volunteer to go with you? And I got a gentleman, Herb, to go with me. So here it is Monday morning, Herb and I early in the morning sitting outside this event, and nobody's there. And I'm trying to call, he was my manager at the time, so I'm trying to call him to see what's going on. Well, the event had been canceled, and he forgot to tell us. That volunteer was mad, and he didn't come back to volunteer. But he kept apologizing, and he said, I'm sorry, you know, it's not you, because it wasn't the first time that the manager had asked him to participate in the event, and there was no event, or he didn't show up, or the manager was late for it. So he said to me, he said, it's not you, because I've worked with you, and you know, you've been great, but you know, working with him is horrible. So he don't volunteer anymore. So yeah, so make sure I always try to follow up with them as well. The wrap up, think of one tip that we talked about or discussed today to take back and maybe put in place. I wanted to do this so we can have like maybe 15, 20 minutes to kind of chit chat and talk, because when I go to conferences and things, I get more out of just, you know, people having like an open forum session, talking about various things and getting ideas from people. So I wanted us to be able to have time to do that. Any questions? Any questions?
Did you just start your the Donate Bucks program?
No, it's been in place for several years, but I revamped it last year. 2010, I revamped it.
They're not really using it.
Yeah, because they weren't using it.
Oh, okay.
Yeah.
Do you think it's going to be successful? Or?
Yes, I have several volunteers saying, okay, I need to do this amount of events because I want the shirt. A lot of volunteers like the Donate Life logo, and then all these items will be imprinted with this logo. So they get the volunteer logo imprinted on the item. So they are excited about that because they like clothing items, they want garments. So a lot of them are going for the shirts.
Do you have any negative in the sense that there are events, there are people that don't get invited to things just because other people are taking them? How do you give everybody a fair shot at activities that they can get their bucks?
95% of our volunteers do have email. And what I do is I send out an events list once a week. Sometime it may go to every other week, depending on if we have any new things added to the list. And what I do is it has our needs. It has the event, location, day of the week, it has everything on there, address, because some people want to know where it is, they don't want to go too far from their home. And it has how many volunteers we need, 2 volunteers needed or 3 volunteers needed. And then the first person that, respond back, I usually put their name in there. Once we get full of how many people we need, I usually shade it out blue so they know that event is full, we don't need any more people. But I do have a volunteer, she always waits till a couple of days later, and she's like, oh, I'll do this, and she always brings somebody else with her. So she's like, oh, I'll do this, this, and this. And I'm like, well, most of those are filled up. And so I tell her, if you want to do it, you and that person want to come together, just respond early. If you got to back out, then you have to back out, because usually somebody else is waiting to do it, or they say they can do it. But I just I don't want to have 5 people at a small church health fair, and then they're going to be bored.
Steve, Latrice, do you put together the events, or call places to try to match?
That's something we get a lot of places that call us for events.
Oh, okay.
So me and another person in the office, Lauren, are the ones that usually get the requests for events. With me doing faith-based outreach, we get a lot of events through that. Having a partnership with Baltimore City, we usually get a list of events that they're having, and sometimes we do call those events. But we kind of try to ask the volunteers to look in their community paper for events or places that we should be. We have some volunteers. For us, our office is located in Baltimore, but so we kind of in the center of our service area. So we service 3 hours west of Maryland. We service 3 hours across the shore, eastern shore, across the bay of Maryland, down all the way down to Virginia, and 3 hours, and south. So our service area is from our office is about, really 2.5, I would say, I guess. 2.5 all around us is what we service. So it's pretty a large service area, and we have a lot of volunteers that don't want to come to Baltimore or the surrounding counties to do events. On the Eastern Shore, we have those volunteers who say, I don't want to come to the West Coast to do events. So we have the regional volunteers down there do events, and they're doing a wine festival today. I wish I could be there, but so they kind of take ownership and do some events themselves. They just usually send us the paperwork of any events that they find, and like the wine festival, this is their first year doing it, so they'll find out that we don't belong at all events. It was a cheap event to do, and so I just said, well, we'll let them do it, but they'll find that some events, and I explained it to them, some events people would throw out brochures on the ground and not really care. We really don't fit in unless it's like a health type of venue, but we kind of put the onus on the volunteers to kind of help us find events, because in our department, it's really only 3 of us. It's 3 of us that do public outreach, so we don't have a whole lot of people to search for events.
Latrice, talk more about, you said there's certain events that we won't do or aren't. What kind of stuff do you stay away from?
We've never done a wine festival before. So this is I let them do it, just so they can see what it's like. But unless they have a health connection, then we really kind of don't fit in. Like in Baltimore, they have the Grand Prix coming in September. So a lot of the volunteers keep saying, you need to do that, because it's going to be all these people in the area. We have to find out if there's going to be a health tent there, because otherwise people are coming to see the race. They don't want to, gather information on organ and tissue donation. We were one time invited to the Taste of Baltimore. I think they have it everywhere, but where they do the different sampling of the chef's food. We were invited to sit up an information table there. Well, some of the staff went. We didn't ask the volunteers to go. Some of the staff went because they got tickets to taste some of the food. But they said that the stuff ended up on the ground. So we try to stay away from events like that unless they have like kind of a health component. We kind of try to stay away from it.
Mark?
Ms. Price, commend you the fact that I think that you've gotten it. I serve on a lot of boards, and one of the things that volunteers are having back in their mind is nobody said thank you. They don't appreciate what I do. So the art of thank you is a good thing. Apparently you've got it down. I want to commend you for that. And I'll tell you, you get a lot more of a thank you than you do with kids. You've done obviously a very good job.
Thank you. I always, and I remind our staff, if you're working with a volunteer, please say thank you on my behalf. And I try to send out an email the next day, or because my phone, you know, I can do that. I try to send them a thank you for doing that event. April was just so crazy for us. We did 60 events just in the month of April. And so, at the end of the week, I would just send it out to the whole volunteer group. If you did an event this week or you're doing an event coming up, thank you, because it's crazy, and they understand that it is crazy for us. Like I mentioned, it's really our communications department. It's really a staff of just 3. It's the director, Lauren, and myself, and then we have our hospital services department. So if we're doing an event in the hospital, they will help cover the hospital event, but we relied on our volunteers to kind of help us get through April.
More in a recruitment fashion, it sounds like you are not pretty well established, but have enough people in your base. I experienced it in my water polo group, so it was kind of the newer group, and I'm thinking about starting a chapter. Is, the first meeting, there's only like 3 or 4 people, so they're kind of discouraged to come back. But then if they don't come back, then there's no one there, and then there's not much to do, and then it's kind of like a circle of, no one wants to come because there's nothing to do, but there's no one there, so there's no one else that's going to come. I don't know how to break that circle.
Maybe you can try to encourage them to bring somebody with them.
Yeah.
See if they will bring somebody. Like we have in the booklet as well. If you bring volunteers, if you recruit volunteers, you get a certain amount of donate life bucks. Well, I had a volunteer in October. She brought 10 of her family members to sign up as new volunteers, and then last week she sent 2 more. So I said, you're really cleaning up, and in the recruitment books, and you get a certain amount to recruit a volunteer, and you get a certain amount if they do complete training. Because I do have another 100 people who say, oh, I'm interested in being a volunteer, but they haven't made it to the training. So, I just keep them on that list, and I always constantly invite them. I don't delete them off. I constantly invite them to the training because, one day they'll make it on the training side. But she has recruited probably 15 people since October, and that have been already trained.
The one thing I'd share in Philadelphia, Elizabeth, when we got the chapter restarted, was very concerned because there's a lot of organizations there of volunteers doing the types of things that TRIO would do. And to understand that we weren't competing with them, in fact, we encourage our people to support them. So for example, in the OPO, which has a very well organized, Katie Ford right up there, is a Latrice. She's very good at it, and she builds very strong relationships. And so we recognize TRIO members who support these other groups for what they're doing too, as representing TRIO to those groups. So it's not, oh, they're doing it, we can't do it. Yes, we can. In fact, guess what? They're the place that people go to ask for speakers. Well, we don't want to do that. We want to be the speakers. So when these things come out, we're responding to them just like every other volunteer. And in that way, taking the strength, same thing with speakers training. They do speaker training. We don't have to do speaker training. Our people go and get trained, and then we'll be on the list of those contacted. So finding the synergy between these other groups that strengthen what the priest is doing, for example, in Baltimore, so we're chapter there.
I know, it's long gone.
Yeah, and so there's another thought, we'll deal with it. Okay, Dave?
Where I'm from is a pretty large area, and we have members, come a distance. Do you think that gas is affecting their volunteerism?
Yes, definitely.
Maybe one of the rewards should be a gas card?
Yep.
Bucks?
Yeah, I think, and sometimes we don't, the unfortunate part is we aren't allowed to give our volunteers a stipend for, or for anything for mileage. Yeah, we don't. And I've asked before, and it's been taken to the directors, and comes back, well, we don't want to look like we're paying them to volunteer, but always just remind them that they can put it on their taxes. But what we do is, because I mentioned that we're 2.5 hours out for certain events, if we're in the Western Maryland area, we don't have that many volunteers there. If we need to have a speaker go out there, we will give them mileage or a gift card or something if they had to travel that far to an event.
Gift of Life does it by miles rated, so it's got to be more than so many miles. But when you're doing something in Philadelphia, for example, you're not parking the car, that's $20.
Mm-hmm.
I'm sorry, can't afford to go there.
Yeah.
Unless I get reimbursed for it.
We do reimburse for parking, yeah.
Okay.
CPDM reimburses for mileage, parking, everything. I'm just curious.
Oh, is that where you're from?
Life Bank does also.
Okay.
Midwest Transplant Network,
you know, usually most places we go are more rural, so there's not parking fees, but they do pay mileage.
But they limit it to, it's got to be a distance as opposed to 5 miles? No? Okay.
All right, yeah, they do that.
I want to talk to them about that because it is getting tough, and like in our circumstance, to get over to Philadelphia, if you're in New Jersey, there's a $5 toll going across the bridge. So you pay $5 just to get over there, then you're parking at 20, and, you know, probably 10 miles each way.
Mileage, it's whatever the federal mileage rate is.
I'm gonna bring it up again.
You tell Charlie to go.
Yeah.
I'm sure we used to use our numbers.
Yeah, I'm gonna bring it up again.
He's
It's
falling
definitely,
behind.
definitely with
It's
the,
best practice.
definitely with gas. Because I do have volunteers say, you know, I only want to stay kind of in my
Yeah.
community because of the gas, and I totally understand that. Because it's like, I filled up my car this morning, it was $60. Wow. You know? So, yeah, I totally understand.
$100 for my first car.
Yeah.
Every time I fill up my car, I keep thinking, I have to pay $100 for my first car.
Any other thoughts out there from your own experiences or the challenges that maybe play into what Latrice has been talking about here?
How do you keep somebody from getting burned out? I mean, a lot of times, like we get a new transplant recipient, they're high on prednisone and everything, they want to do everything, and then all of a sudden they say, whoa, I mean, what can I do?
We, like, for example, we had this volunteer, African American donor family, and we don't get our African American donor families to come out that often. And she came out immediately after her son was a organ donor. He was a 7th organ donor, and she started speaking. So after a year, maybe she burned out. She said, "Okay, I'm going to take a break." And then she came back on board, and then she did it again. And so when she came back, like that third time, I told people within our office, because they always want to call Darlene, ask Darlene, call Darlene. And I said to them, we can't do her like that. She'll get burned out. She won't do any of this. We have to reserve her for real special occasions. So, and a lot of times they didn't want to listen to what call and ask her anyway. And she did it. She did it again. You know. So she's like, okay, I'm quitting this. I mean, she quit everything. She was on our clinical advisory board. You know, she was on everything. So she quit everything, and so she's been on hiatus for about 2 years now, and I recently just called her just to chat with her. And then I said, well, what are you doing? And she's like, I'm doing nothing. I'm like, can you come in and talk to the staff? And she's like, oh. She said, you had a motive to this call. I'm like, no, not really, not honestly, but I just want you to come in. You know, this is the 10th anniversary of Jason's staff. So just come in and just talk to the staff. And she did. And then I saw her at another event. She came behind the table. So she might inch her way back in there, but I try to not use them. Like I say, I send out the list. It's different with speakers because usually if it's a speaker, I usually call and ask them to speak. So I try not to use the same person that often. But it's hard with the donor families because we get very few donor families who want to come out and tell their story because they still kind of upset. Like when I did the public speaking workshop, one of the gentlemen, it was his son, and it's been 3 years, but when it came his turn to get up and tell his story, he couldn't do it. And so his wife she got up and she did it. And so it's kind of hard with them as volunteers because they sometimes just want to sit behind a table or just want to come in and they don't want to tell their story.
What
So
I
I
hear-
try to rotate them around.
What I hear behind that is really being tuned in to the individual and communicating. And that changes over time. So keeping in touch, taking a rest, call her back, she still knows she's recognized. It's a good way. And that's the basis of what I heard you say.
Yeah.
Todd, you have a question?
No, I don't have a question, I see Myers' picture in here.
Oh, yeah.
Steve?
What about matching, if we're going for certain minority groups, i.e. Asians, who you select to speak?
We, in our Baltimore area, we don't have a large Asian population that we reach out to right now. We are starting to develop a large Hispanic population. And we do have, unfortunately, our one Hispanic great volunteer who's a heart recipient, he's awesome and he loves speaking. He moved to Illinois to go to nursing school, but he still comes back during the summer to do our Latino festival. And so he's coming back in June. And but like for the African American community, we do have African-American volunteers and recipients and donor families, that we do get to speak to those groups. But we haven't yet developed a need for the Asian population, but we do have some Asian volunteers.
That's a huge need in the area.
Yeah, we looking at it as a huge need for the Hispanic outreach as well. So we're looking to kind of increase that pool of volunteers. And I do go to, like I mentioned, I go to Pompey's and University of Maryland. Any events that they're having, their holiday party, anything that they're having, I go and I set up an information table to try to recruit people. And then they know me at both centers now. So when they're having something, they call me, or if they're having their support group meeting and they need a speaker, they have me come in and speak once a year to their group. So that's a big way of getting people. And one time I went on Transplant Cafe, and just looked at everybody who's in Maryland, and I wrote up like a little script and cut and paste and sent it to them like, this is who we are, this is what we do, we're looking for volunteer recipients, and I just sent it out. And I got a few people who responded back to me and came in to be volunteers. Every once in a while I look on, Facebook, and because of the blog, people sometimes they like or they make comments and, kind of look at their page and see what they're all about. And, tell them about our program, tell them about our group and who we are. So.
One of the thoughts for that particular area, look to partner with some of the farmers who are also interested in that demographic of your area. And they're looking to get in there in meetings, supporting with food, for example. They'll schedule a meeting, and you can be a speaker there with them and get into the community that way too. And so partnering with the farmers, which I don't think the OPO would want to get involved with. But hey, your local TRIO chapter, there's an opportunity. Very powerful one. But
There's no TRIO chapter in Baltimore.
right.
Yeah.
We do have members that live up there. But how many of your volunteers know about TRIO?
I didn't even know, like, I've been involved since 14 years, since Judy LaSalle was the TRIO member there. And so since Judy, left Living Legacy, which was TRC back then, I don't know of any TRIO members. She was,
I mean, of your volunteers at large, how many of them know there is a TRIO?
I don't think they
thing?
even know that there's a TRIO, so I would take any
See,
information.
we're missing out right there.
Yeah,
Absolutely.
you are,
Yeah.
definitely.
Another great idea.
Because I always say that I didn't think it was a Baltimore chapter TRIO anymore. Because
No,
I
there
remember,
isn't.
because they used to meet in our
But
office.
They're associated with things.
Yeah, you have any idea what happened to, I can't think of her name, Pat?
Pat Leibowitz?
Yeah.
Yeah, no, I don't know what happened to her.
I know her husband was very, 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 very sick.
Yeah.
Phone number doesn't work anymore, hadn't for years.
She used to be on my mailing list.
Got burned
and-
out, what
Yeah, yeah.
Well,
She's
she had
in
problems in
there,
DC also.
Again, you gotta be tuned in to your volunteers, so you don't burn them out, especially when they're that eager up front. You know from experience, that's gonna happen. So you tone down how many times you involve, but at the same time, don't prejudge them. I mean, some of the volunteers, they don't get burned out doing a lot of things, and so you wanna talk to them, you wanna communicate so that you know the situation and you adapt to it. And over time, lives change and needs change, and don't forget them when they stay for a while, whatever. Great ideas.
And another thing that I've been doing is, if I'm going to an event with the volunteers, and they have to come past our office or somewhere, a meeting point, I say, let's meet, and I'll drive, because I do get reimbursed for mileage. One Sunday, I had a donor family recipient, we were going to speak at 3 churches, and it was a distance, and I said, okay, let's meet in Hunt Valley at the mall, and I'll drive. So, they appreciated that, so that they won't have to drive, because at least I do get reimbursed for mileage, so I don't mind driving. And so I've been doing that to kind of help with the punch as well.
Rhonda?
I was gonna piggyback on what Latrice said about the transplant support groups. Those are really important areas where brand new candidates or older candidates have been waiting for a while. They need to see your faces. They need to see someone who's 10 years out, 5 years out. It makes them feel comforted knowing that. Also, if you all have your own brochures, the TRIO brochures,
Yes.
just walk into the transplant centers and say, hi, can I post these for
We
you
can do
all?
that.
Good,
We do that.
good. Thank you. That's it.
And then, I don't know, because, there's no Baltimore chapter, but Clara, I was gonna say, there's now a support group at Mercy for liver transplant, pre and post. And I went there and speak, so that, those are another group of people. They aren't on the waiting list at Maryland or Hopkins, they're on the waiting list at GW, I think. is where they're on the waiting list at, but they get followed up at Mercy Hospital.
Latrice, I want to thank you very much for giving up time on your Saturday. I know as a volunteer coordinator, you do that a lot.
Oh, yeah.
But to come all the way down here to the other side of Washington to entertain us this morning with some great ideas that we need for our organization. And I'd like to say thank you on behalf of TRIO and offer you a book that we talk about speakers, The Road to Happiness.
Oh, thank
Serving
you.
town happiness.
Thanks for having me.
We had a couple other people join us who walked in. Mark Jackson, why don't you introduce yourself?
Mark Jackson, I'm treasurer.
I'm looking back there.
JT?
JT Rose from Jacksonville, kidney transplant recipient of Rachel.
He's a family of kidney transplant
Oh, wow.
recipients. And in the back?
Trudy Anderson from the Washington area.
Trudy, so great to see you. And your background real quick? Why are you here?
Why am I here?
Why are you part of TRIO?
Because this lady, proud that thing.
Okay.
I'm a heart recipient.
There we go.
16 years.
Minor point. So,
But Benno and I recruited her.
okay,
If you all don't know Benno, he's gone.
okay.
We recruited her.
Hearts do stick together, don't we? Trudy, it's good to see your smile.
Thank you.
Please, come, if you're comfortable, come on up and join us up close. Okay, that's fine. All right, great.
Everyone else told you where they're from. I'm from Birmingham, Alabama.
Oh, okay.
I would never know that.
Mark is the type of guy, you ever having a conference call and these people that always say, every time they talk, they say, oh, and by the way, I'm so-and-so. People like Mark don't ever have to introduce themselves. That's Mark, you know his voice, right? And they drive you crazy if they do that. He doesn't, I'm just saying, you know that type. I just want to talk real quickly, and again, we're, get rid of that. We're talking about passionate people changing the world. Up in Philadelphia, there was a woman who lost her husband after transplant, liver transplant recipient, Claire Braverman. This goes back 17 years now. And she came up with the idea, I remember being at the meetings on this work, where she said, you know, we ought to have a run or a dash or something to raise donor awareness. And the OPO at that time had a staff of one director and one person. And they were overburdened with what they had, said, no, we don't want to do that. And she really believed we should do that. So they started, and we had a dash. And I think 100 people came out, and they raised maybe $1,000. And the following year, it grew. This past year was the 17th annual dash. Up on the left, that's Claire Braverman, the mother of the dash. Okay? Back up from Florida for the event, by the way. Moved down there. And
Smart woman.
yeah. And these are pictures that Susan took of the 7,000 participants just a couple weeks ago, raising more than $500 million each year now. This started out helping Team Philadelphia for the uniforms and so forth, and it's grown much further than that. And that transplant house you saw before, that's part of what this is celebrating. And Susan was just quoting a number which is a lot bigger than 500,000. 500,000 what they've admitted to so far, but it's in plus.
I think I heard them say 800.
Okay, so it has gone, I mean, last time I heard it was in the $400,000 range, and the number of participants was was about 4,000 people last year. That's how much it's growing. And so, this was the introduction for Latrice, but we were switching and moving laptops. But can you imagine that crowd coming out? What an opportunity. And so, yes, we did have a TRIO table there, and we were pointing out our new brochures. And for those who didn't get one yesterday, we have them. And the reason I pass these around, if you didn't get one yesterday, take one. My point is this. This template in Microsoft Publisher was something that Steve Binder developed down in the Jacksonville chapter. And he allowed the national chapter, the national organization to buy it for any chapter that wants to use it. And so if you want the template for that to build your own brochure, you can take most of the stuff there, generic type stuff, and make the other parts, the pictures yours, the message about your local area yours, etc. And you don't have to pay anything for that template. They're not cheap to print. They're $2,500. We paid about $350, which was
$2,500?
I'm sorry.
$2,500 for $350?
Right.
Let me know where you went.
Jacksonville.
We went to Steve. I'm not sure if he would do it again, though. He's got a printer down there, but we ended up paying about another $50 for shipping, and he said, you know, you probably could have done it locally. I don't know, we haven't checked what the cost would do it locally, and we lost the shipment in transit. There were 3 boxes and 2 were still missing. And he's caught in the middle right now of, you know, what can he do? He's gonna have to go back and reprint them out of his own money. I thought that was his business. Maybe it's not. Maybe he was just helping us out. I don't know. His business really is the graphic side, I understand now. So putting the graphics together, the other part, he quoted us a price, and I thought that was his business. So we're happily caught up in those one-off circumstances right now that would be a problem. So I'm not sure if he'd take on it, go to his printer shipping type thing, maybe he'd work with his printer, but 2,500 weighs a lot of weight. That's more than 20 pounds. So he put it in 3 separate boxes and mailed it and so forth. And we're having a little bit of an issue with that. Other passionate people change the world. We talked about Howard Nathan yesterday. Just a week ago, our TRIO chapter was meeting at Jefferson Hospital, which is not where we normally meet, because one of our members, Faith over here, the young lady here, and her husband, were at the event honoring the 20th anniversary of the National Transplant Pregnancy Registry, which is a worldwide thing. For 20 years, they've been building a database of people post-transplant having children and gathering information so that somebody who questions that can get advice and have it based on real data. And so these are some pictures that our photographer Susan took, and passionate people making a difference. Vince tells the story. We ran into a woman who basically asked about having a child after transplant, was very concerned, this and that, and there was no answer for it. And so he took that as his mission, and any place in the world, you talk about pregnancy after transplant, you're going to hear about Vince Amendment. And so we had a neat time there at our meeting. This is not from that particular meeting. We weren't dressed up like that for our meeting. But we were there to help celebrate that, and it was really nice to get food served at their meeting, right? Because we were there with them. And there was some really neat entertainment, some great speakers. And Howard Nathan, he's every place. So when he came in, I thought he was just visiting. No, he was like the keynote speaker. They used Skype to bring in Dr.
Joseph Murray.
Joseph Murray, all right? Did the first kidney transplant on a woman, for example. Living kidney transplant between identical twin women, for example. They had him, he's got to be 90 years old.
93, I think we heard.
93, at home on the other end of Skype, okay? Well, as often happens, it was a great idea, but it really wasn't working. I mean, he was there, he could hear, he was responding, but it just wasn't connecting. Howard gets up, as he often would, went over, and he said, here, and he adjusted the camera so that the doctor could see the audience. Oh, okay. And then he turned around and said, why don't we bring all the children up to say thank you to Dr. Murray? Well, now we must have 20 children up there, all gathered around in front of the camera, talking to him, and he engaged them. It became a hit. It became a hit. Because somebody had the idea, but Howard Nathan, passionate person for anything like this, got involved and used his experience and skills to bridge that gap. And so, one person making a difference